Welcome, everyone, to another edition of SCRC's Let's Talk Caregiving. I'm your host, Roberto Velasquez, President and CEO of Southern Caregiver Resource Center, and I'm here as always with my co-host, Marta Rañón, our Executive Vice President. Hi, Marta.
Hey, Roberto.
Today we have a very special guest, Carline Cadet Francois. Carline is the CEO of Carline Cadet Francois, LLC, based out of Fort Lauderdale, Florida. Carline owns and operates assisted living facilities and advises others how to do the same with professionalism and empathy and with a focus on caregiving. And I'm really happy you're joining us here today, and I want to welcome you to this podcast, Carline.
Thank you so much for having me. So happy to be here.
Yes, this is such an important topic. I know that a lot of our family consultants, when they're working with family caregivers, at some point have to talk about placement, have to talk about making that decision. And so, this is, again, a very important topic. I know our audience will be very excited to listen in and hear some tips, or maybe just kind of re identify with some of the things that will be commented today. It's a very important topic. I know in our country, it's a very small percentage still of people that actually live in assisted livings or in nursing homes. But what's really staggering is the statistic that about 70% of people will require assisted living placement at some time in their lifetime, at some point in their lifetime. So, again, it's not a topic for others, it's a topic for all of us. So, again, welcome and thank you.
And I think that in talking to some caregivers, I'm so glad that we're having this discussion today with Carline, because I know that there is a lot of reluctancy on the part of caregivers to place or to look for another location other than the person's home to take care of that individual. But we all know that as a disease progresses, as for example, a cognitive impairment like dementia, like Alzheimer's, the care is incrementally bigger. And so there comes a time where you need to go outside the home and maybe place. How do you help caregivers, Carline, really decide and grapple with that decision? Because it's not easy, right? We all want to just, not have to worry about making that decision, but sometimes we have to consider it. How do you work with caregivers when it comes to that?
So that is a very important step when it comes to knowing when the time is right. I like to say, first, look at how you, as the caregiver, how you feel. And then I cover some of the symptoms of what your loved one displays that will help you decipher that, okay, this is time for either an assisted living or a nursing homes. As the caregiver, if you feel that you are overwhelmed, if you feel you don't have a way to go and that you need some help, I like to say, reach out to the people around you. For example, even people in the church, they can assist you sometimes to give you a break where you can walk and read a book or some time to yourself. Now, as far as for your loved ones, some of the symptoms that may be displayed, you may see that they are extra agitated. They stop eating. They stop wanting to communicate. And if it comes to that point, reach out to a professional, reach out to a doctor, and look into perhaps finding an assisted living that will alleviate some of the stress from you, but then provide some help for your loved one. All the resources will come to them, and it will be a team of people helping you and your loved one to feel safe and to help them with their needs.
Yeah, you bring up a very good point, that support system that everybody needs. Here in San Diego, in California, we have the Caregiver Resource Center systems of care. It's the only state in our nation that has Caregiver Resource Center systems. And so we can help families up and down the state, depending on their location. But when families come to us, they're in such crisis already. In fact, most of the family caregivers that we work with, are putting in over 40 hours a week of unpaid care, providing care and support to their loved one. Usually, about 80% of our clientele have cognitive impairments, and most of them with Alzheimer's disease. So it is very overwhelming, very exhausting. The emotional toll on the individual, on the caregiver, is very high. Often, anywhere between 30 and 40, 50% are also suffering from depression, clinical depression, and participate in our counseling programs and other things. And yet, we want to be the one that takes care of mom and dad in the home. And and sometimes it just becomes impossible. And I know, Martha, you talk a lot about self-care in your programs that you teach. Um, and I'm sure you probably hear a lot of stories from people as well.
Well, I'm just thinking back to when I was a caregiver, and I know that a lot of times, I don't know if it's, societal or cultural, where we have this expectation that the family is going to take care of those individuals forever and ever in their homes. And going with what you are saying, Roberto, that with self care, sometimes you really cannot do that. And it's okay to come to that decision, but it's not supported necessarily by family, by friends, by society, or culturally. And I remember when I was caring for my great aunt, there came a time when her decision, I'm sorry, her care was so greater than what I could offer. And so I started pondering, placing her where she could get this 24-hour care, because I couldn't provide. I am not a nurse. I needed some assistance. And I just remember the backlash, and I'm not the only one. I'm sure there are many caregivers who have experienced that. Carline, I don't know if you've heard similar stories.
I have. I've come across, caregivers feeling guilty because they feel that bringing mom to an assisted living facility is not a good thing, when in reality, it is the best thing that you can do for yourself and for mom. And because life happens, a lot of my clients' family members, they have little children, they have jobs, they have careers, and they have things that they do in order to support themselves and be able to make a living for themselves and their children. So coming to the point where assisted living is necessary is an important choice, and there's no need to be guilty about it, because at the end of the day, you're giving your loved one a team of people, including yourselves, to help meet their needs.
Right. And I think it's really important to consider also costs of care, right? I mean, a lot of families will say, well, I can't afford assisted living. I can't afford a nursing home. And of course, nursing home, for most people, nursing home is people apply to Medicaid and try to get coverage for nursing home care, which is the only way to pay it, unless you have, hundreds of thousands of dollars a year that you can put out for nursing care. But assisted living uh, is costly, but so is in-home care. And that's one thing I think families actually don't realize. I mean, on average, and this is again like maybe a shared room or something. Um, on average, it could run in assisted living like $4,300 a month or something like that, right? If you're providing in-home care and you're paying, like in California, the rates are really high for in-home care, professional in-home care. So you're paying maybe $40 an hour. And if you're putting in, like our family caregivers, putting in 40 hours a week, that could come out to $86,000 a year in-home care, where assisted living could actually maybe be a little less if it was maybe a shared room. So, we think about, oh, we can't afford to do it over there. And yet, if we were paying for that in house 40 hours a week, it would be more than assisted living.
And also considering that most of us who are caregivers or have been caregivers, we're not trained in that field, right? That's not what we do. We do it because who else is going to do it, or because we're caring for those individuals, we love those individuals. But I cannot pretend to be a doctor when I'm not. And so if that person needs higher skills or higher level attention, then maybe we need to consider that.
And it plays safety play a role into that too, because
Hmm.
you're doing what you think is best at home. Not knowing what you think is best for mom is probably not the best for mom. But if you end up at a good assisted living, you have a team of people. They are licensed, they are trained. They know when to reach out to the doctor, when to reach out to the psychologist, to make sure mom gets the care in exactly how she needs it. And I think it plays a role when it comes to safety and the overall need of your loved one.
Caroline, what do you tell families who say, well, how do I trust somebody's going to take care of mom? Because that's a big question sometimes. Like, how am I going to trust you to do the good job that I'm doing at home, even though I know she now needs to be in an assisted living community? What do you tell those people that are afraid that they're going to get hurt or something or neglected?
That's a legitimate concern. And I tell them there's nothing wrong with having that concern. What should happen is pay attention to your senses. When you go and conduct these tours to these facilities, pay attention to the body language of other residents who lives there, the caregiver who's providing the care, and also what does it look like inside? Does it seems to be organized? Does it smell like it's not supposed to? Is everything appears to be clean? Because chances are, if the caregiver and the other residents in there seems to be at a sound place, that tells you that there's a good management, and that tells you there's some kind of order in the facility, and that mom needs will be met. And when it comes to that too, being able to have good people plays a major role. So pay attention to reviews and other things, and what other people who may have come in contact with that facility have to say about them.
I guess doing your due diligence is what you're saying, Carlene, because I remember too thinking, wow, I this is such a daunting task, but you know your family member best, and you also know what would be acceptable and not acceptable. And I remember visiting facilities, right? Because I also heard, hey, visit them, make sure you see them. And I saw some places that I couldn't believe, and they look beautiful on the outside. And then once you start getting into the inside and start asking the questions and start interacting with people, that was a different experience. And I remember thinking, something in my gut just tells me I don't feel right. It doesn't feel right. And I didn't end up going there to those places, but that has a lot to do with it. Trust your instincts, see what would be acceptable for you as a family member and your loved one. That is critical. That is having that, making that time to do that.
Yeah, Martha, thanks for sharing that. I also had a very similar experience. That wasn't for placement issues related to my family, but I was visiting one of our partners in the past, and out in the community, in an assisted living community with memory care, because they specialized in Alzheimer's. And I was in a meeting with their CEO, and I'm the CEO of our company, and we're sitting there in a closed meeting at their facility, and and it was really interesting because a resident who lives there, that's their home, walked in, opened the door, walked in, and started talking with us. And instead of the CEO saying, "Hey, you don't belong here, go back outside," or something of that nature, the CEO stopped, greeted this individual, and then engaged them into our conversation for a moment, and then redirected this individual, which was like amazing to me. I was floored by how much attention and care, and how they acknowledged that individual who, of course, had Alzheimer's and maybe wasn't sure. Maybe she was there because she thought she should be in the meeting, whatever the reason. But the way they addressed her, the way they put her first, the way they did it, it was just, I just felt, wow. I think, wow, if I ever had a need for placement, this would be one place I would consider. And but it was just the attention that they gave that individual.
And that was pretty good. Believe it or not, we have a lot of facilities who are like that. But sometimes the bad apples get the praise more than the good apples does. And
Yeah.
I'm very happy that you bring that story up.
Yes, yes, and I think one of the things, I know at Southern Caregiver Resource Center, we actually talk with families all the time about placement. Most of the time they're on with us, and they're getting support in the home, but at some point the conversation does come up with our social workers, our family consultants. And so when that happens, we have lists. We have a checklist of things for them to look at when they're going to maybe interview some assisted living communities and homes. Checklists that include, what kind of activities do they do? How do they do mealtime? Is it a social setting? Just all kinds of different things to look for, including, as you were saying, Carline, does it have a smell to it? Does it look disrupted? Are there people screaming in there? I mean, those are things that you got to take a look at. Um, so it's important for people to get support. It's important for people to reach out to organizations like Southern Caregiver Resource Center or others in your community that can give you kind of guidance when it's time. Get that guidance from the professionals.
And I think more than anything, reminding our caregivers that we don't know everything, right? And we might not be able to predict everything that we're going to be needing. But if we have someone along the way to rely on, increase that network of care, increase that network of support. Maybe I can lean on Carline and say, hey, what do you suggest? This is where I am. What are some tips? What are some suggestions? And then that's how we as caregivers are able to make these decisions, which of course are difficult, no matter how you slice it, no matter what decision you're making. But at least now you are informed and you are making that decision based on the best information you have at hand. What do you think, Carlene, about that?
And having these conversations as early as possible play a very vital role. I like to say to people, because I get to see, I own an assisted living. I deal with the family members and the placement professionals that are doing a really good job bringing them to me and making life easier for them. But having the conversation early before mom and dad really, really need the help plays a vital role. And oftentimes, I find that family members, caregivers, we feel guilty to initiate the conversation because we feel like, oh, mom is going to feel like, I don't care, or, we feel bad. But the conversation is worth having, and having it as early as possible is very important.
I'm so glad you say that, Carlene, because I've heard from many caregivers who say, my mom made me promise I would never do this. So I could not even contemplate that option. But again, we have to remind ourselves that the disease progresses, the needs of the care receiver progress, and they change drastically. So therefore, we have to be able to consider options to offer the best care possible at that time, and really not be so rigid in our thinking that, oh, I would never do that. Take away the guilt from that and think about it, reframe it. I would consider that if it means better care for my loved one.
Absolutely, Martha. And one of the things we often teach family caregivers is not only self care, but not to use words like never. Never say never when you're a caregiver. You just don't know. And you also don't know, you might go in this, strong, and I can do this, and I can take care of things, and I can organize things. Most of us want to do that, right? We want to be the caregiver when we're in situations. like where we're caring for a mom or a grandmother or an aunt that said, "Don't ever put me in these don't ever place me." But we can't say never, because our health might be in jeopardy. The caregiver's health might be in jeopardy. A lot of times, our family caregivers are dealing with their own chronic illnesses. They might be diabetic. They might have heart disease. They might have hypertension. They might have other conditions that make them unable to assist somebody with limited mobility in the home who also has Alzheimer's. So there's a lot to consider, and these are very serious questions that you kind of have to reflect on. And sometimes, once again, I think it's important to turn to professionals, to turn to organizations like the Caregiver Resource Center, Southern Caregiver Resource Center, because they have professionals that can help guide you and help you understand and not feel guilty about making these tough decisions that sometimes they're inevitable. You have to do them. Well, that's all the time we have for this edition of Let's Talk Caregiving. To hear more of our podcasts, follow us on your favorite podcasting platform or visit our website at scrc.care. I want to thank Martha for co-hosting another important discussion, our guest Carline Cadet Francois, and our audience for tuning in. If you're providing support to a loved one, you don't have to do this alone. Asking for help is not a sign of weakness, it's a sign of strength. To connect to our programs and services, visit our website at scrc.care or call us at 1-800-827-1008. If you live outside of San Diego and Imperial counties, visit caregivercalifornia.org to connect to the Caregiver Resource Center closest to you. To support our efforts and make a tax-deductible donation, please go to scrc.care and click on the Donate tab. And remember, SCRC is here for you, caring for those who care for others.